This phase 1/2 nivolumab paclitaxel ramucirumab trial is a one-arm trial which was conducted to evaluate the role of combining the efficacious second-line regimen ramucirumab plus paclitaxel with the checkpoint inhibitor nivolumab. In this trial, patients were stratified either to be PD-L1 overexpressors or PD-L1 negative patients. So this trial was a two-part trial, but overall, overall 43 patients were enrolled. And the primary endpoint was the 6-month progression-free survival. And this primary endpoint, the 6-month progression-free survival with this combination in the overall population was 46%, which is pretty good. Interestingly, there was a very encouraging response rate. The response rate was 37% in the overall population with this combination. And also overall survival was encouraging, as median overall survival was 14 months, roughly 14 months in this cohort. Interestingly, when you look at the PDL positive population, so all of these results were better in this population. It's a signal providing trial, and I think that the overall conclusion is that this regimen clearly deserves further investigation.
With respect to the second-line Frutiga study, which is fruquintinib, second-line study randomizing patients to this anti-angiogenesis tyrosine kinase inhibitor to paclitaxel, is a study coming out of China, phase 3 study that has not yet reported results. This is one of many studies that are coming out with tyrosine kinase inhibitors, some of which have already reported out in the third-line setting that we can talk about. This one is moving to second-line setting. And so my thoughts on it are, one, that we do know that paclitaxel plus ramucirumab is a standard option at this point based on the Rainbow study that was reported in 2014. And so this study, even if it does show benefit compared to paclitaxel, we note that the control arm is an inferior control arm with just paclitaxel alone without paclitaxel and ramucirumab. And in my opinion, it's not really moving the needle forward, even if paclitaxel plus this tyrosine kinase inhibitor is better than paclitaxel alone. My sense is that it might have worse toxicities than, say, paclitaxel plus ramucirumab and monoclonal antibody to VEGF-R2, but we will see the data. But ultimately, I think that this will not be practice changing, even if it is, quote, positive, coming out of a Chinese-only population and with the other caveats that I mentioned.
As you know very well, and Keynote 061 trial is a global trial for advanced gastric cancer in second-line setting, paclitaxel versus pembrolizumab monotherapy open-label trial is unfortunately failed over survival benefit and progression-free survival as a primary endpoint in advanced gastric cancer and second-line setting. 063 trial is only Asian trials except for Japanese population. Korea, China, Taiwan, and Malaysia population gather in this trial, and are very similar to study design of Keynote 61 trials. I also hope this data showing the benefit in overall survival second-line setting in Asian people.
The Protein 58 trial is a phase 2 trial evaluating the role of the combination of irinotecan and regorafenib in the treatment of patients with metastatic gastric cancer in the second-line setting. This is in fact an ongoing trial and or what we call trial in progress. This trial is a phase 2 trial which contains 154 patients, and patients will receive a combination of irinotecan and nivolumab. The primary endpoint is overall survival, but we're still waiting for results.